Hi, this is AINeuroCare Care Stroke and Epilepsy Specialist. In this starting module of work type mix, the first thing to understand is that clinical life is a spectrum. It is not a static thing. It is an actual career lasting about 35 years. There are life changes that are going to go on. There are financial changes that are going to go on. Your health is going to change. Your family is going to grow. There is going to be a significant change in your body itself, let alone anything else, your cognitive capability, your physical capability, that is going to change. But if you're not going to plan for it, that is understandable that you're going to plan to fail then. So it's very important that you do understand that you plan from the very beginning as a spectrum. Let me give you an example. I did neurocritical care fellowship. I love the hustle bustle of the ICU, the stroke, the telestroke, the teleneuro ICU and all that. But at the end of the day, I also did an epilepsy fellowship. And the reason I did that is because first I needed to take care of status patients in the ICU. But the second thing was, if my bodily habits change, if I get into severe disease, if I get some problem, if I go to a place where there are no neuro ICU jobs, I have a fallback plan. I have a plan in which I can open up a clinic and be an epilepsy specialist as well. So not only that, you have to make sure that you understand that whole spectrum of life, whole area and arena in which you can operate in. You can operate in an inpatient, outpatient, telemedicine, procedures, etc. Whatever you do, you need to plan for that. And you have to understand that this is just the clinician portion that I'm talking about. Then, of course, I have the whole digital health portion, the academic, the entrepreneur portion, and what I'm doing right now. So you can plan the whole spectrum as the way you please. But the more important thing is to understand where your purpose comes from, right? You have to, this is what we discussed in the lifestyle consideration. I'm going to repeat it again. The purpose is why. The why needs to be very clear for you. You need to create that why for you. And then the how, the passion, what exactly in that particular field you want to create. And then also tie it back to your personality. Because if it's going to be very away from your personality, it's going to be too far removed from your personality, then you're going to burn out. Then you're not going to be able to excel in it. So that is the mindset. You always have to keep that in mind. This triangle is sort of something that you should always paste it as a medical student on your wall to make sure that you continue to refer to it and make a tweet about it. There's a tweet of purpose, there's a tweet of passion, and there's a tweet of personality that clarifies in every small fashion that this is really what my goal is. 3 tweets. Now, this is, again, I told you, I have been doing this for some time, and it is a process, it is a journey, it is not a place or a destination. And the medicine field in general has been advancing at a massive pace. Every 73 days, the medical knowledge doubles. But in this era where we're living in the digital healthcare, where there is a true paradigm shift going on, you need to learn and learn again. Now, Foo Fighters is my favorite song, and this is my morning stoic. So I listen to this song every morning and I say, it's times like these when you learn to love again. That's the true lyrics, but I change it. And I say that it's times like these when you learn to learn again. And the best way to learn is to teach. So it's times like these when you learn and teach again. So continuous learning in this era is just an absolute must. And we have these superpowers as physicians and medical students. And by the time we have gotten to that era, there's one thing we can say about ourselves that's probably the most true and most generalizable. So our superpower is learning, period. Utilize that. Do not get back on it. Do not fall back on your learning at all. Continue to learn newer and newer skills, and not just clinical skills, other skills as well. And we'll continue to do that. And then that's where I keep telling people from my neurology pocketbook students as well, if you're going to consume intentionally and systematically, you can also create comprehensively and effectively. So not only that you try to consume intentionally, not try to consume just willy-nilly, if you do it a little bit more intentionally, a little more systematically, you can create different pathways as well. So that's one thing to also remember, that not only learn, but also produce. Not only consume, but also create. Another thing that I do personally as well, a yearly review. What is my mindset? Because it changes. I'm a human. Everyone changes. What is my skill set right now? Because I do acquire new skills and I get bad at older skills. And what is my tool set? Because again, as you go further, you have some new people that you have met. There are new hires that you have done. The tool set changes as well. New software systems comes in. New operating systems are coming in, for God's sakes. So what we have to see is that within an yearly review, I always make sure that you do that, and then you take into account your mindset, your skill set, and your tool set, and then move forward with it. Now, I'm going to touch upon these 5 personality disorders, right? In terms of what kind of physician you can be. You can, generally people fall into these 5 categories. That doesn't mean this is the end all and the be all. I'm going to come to that in a little later. But generally, do people fall into these categories? So I'm going to go into these categories a little more. And then sort of you can, chart your path according to that. However, again, understand this is not just a limitation. I'm going to be honest with you. There are 3 new sort of skills that I learned within the last year, or there are 3 new designations that physicians do that I learned last year that I didn't know about. So there's definitely room, right? I mean, there are people who have a whole career doing medical legal. I haven't discussed that. There are people who have a whole career being medical directors in insurance companies. I haven't discussed that. So there are definitely roles that I have not discussed. This is sort of an idea for you to understand there are multiple clinical spectrums, and you can be in one of them or all of them or part-time in some of them, etc., etc. But if you know the spectrum, then you can design, then you can choose better. Coming back to that is like your passion and purpose. There are multiple ways to achieve that. There's more than one way to skin a cat, right? There's literally more than one way to bake a cake, cook an egg, peel an orange. There's more than one way. Your passion, your purpose can be achieved in multiple ways in clinical spectrum and in healthcare industry in general as well. So remember that in mind. One thing, again, as I said, if you're not going to fall into these 5 categories, pick your own. And sometimes there are companies and people who have created their own. Give me an example from a software side, which is coming to the healthcare side. In software, there's a term called developer advocate. We never had this term. What kind of bullshit is that? Like developer advocate? They're the highest paid people in software industry. It is coming to healthcare industry as patient advocates, because industry companies are figuring out that they really need to understand that liaison, that connection between the patient and the tech. And therefore, there is a new term now called patient advocates, and they're getting paid for it. So again, these are things that are going to be evolving. They're things that are going to be continue to improve. So be mindful, look at this. And again, as I said, follow me on LinkedIn or any other person, Arlene Myers, Anthony Chang. There are people who are sharing a tremendous amount of wisdom for free. Get in touch with them, get in touch with me, and we can improve upon my knowledge and your knowledge. Again, grateful for your time. If you save a life, it is as if you saved the life of mankind. Please make sure you like, comment, share, and subscribe to my YouTube channel and my newsletter. If you want to get in touch with me, the best way is to go through Twitter or via LinkedIn. Also, make sure you follow the Academy website for regular updates. Thank you so much.